Assalamualaikum. My name is Farid Wajidi, and today I'm going to present about introduction of understanding in early childhood education, health, safety, and nutrition. Early childhood education (ECE) focuses on children's holistic development, including health, safety, and nutrition, starting from the family as the first learning environment. Good health practices, safe surroundings, and proper nutrition are essential for children's physical growth, well-being, and active participation in learning. Therefore, this assignment aims to evaluate and compare how Malaysian and South African manage health, safety, and nutrition in early childhood education contexts. Although both countries use different approaches based on their policies, the main goal is the same: to ensure children's overall well-being and support their long-term development. Assalamualaikum. Next, we moving on to policy overview in Malaysia. Malaysian nutrition policies aims to improve public health by encouraging healthier food choices. One key initiative is mandatory nutrition labeling, introduced under the Food Regulations 1985 and enforced in 2003. This requires food manufacturers to display important information such as energy, carbohydrates, protein, and fat on packaged foods. Another initiative is the Healthier Choice logo, HCL, which helps consumers identify healthier options. These efforts are supported by the National Plan of Action for Nutrition Malaysia (NPANM), which promotes balanced diets and encourages healthier eating habits among families. Also, Malaysia promotes healthier lifestyles and disease prevention through nation policies and programs. The National Nutrition Policy and NPANM aim to improve overall health and reduce issues such as obesity, malnutrition, and infectious disease. Campaigns and programs also help educate people to take care of their health starting from home. Lastly, Malaysian food safety policy are guided by the Food Regulation 1985, ensuring food quality, hygiene, and clear labeling. The government follow international standards such as those set by the World Health Organization (WHO) and Codex Alimentarius to maintain global food safety standards. These efforts help create a safe food environment and help healthy eating. Thank you. Next, we moving on to policy overview in Malaysia.
The article Managing Young Children's Health and Safety During the Early Learning Years explain the important policies about children's health, safety, and nutrition in South Africa. One main part is the national standard and legal framework, which includes three key frameworks. First is National Norms and Standard for Partial Care. Second is United Nations Convention on the Right of the Child, UNCRC. Third is Sustainable Development Goal, SDG. First, many early childhood development (ECD) centers do not meet the required standard for children aged 0 to 4. Second, the UNCRC states that every child has the right to live and grow in a safe and healthy environment with proper care. Third, SDG 3 focuses on improving children's health so they can live longer and healthier life. Another important part is departmental initiative and transition, which include nutritional managed by the Department of Social Development, DSD. Second is migration of ECD from DSD to DBE. Third is registration requirement. The DSD provides healthy menu to ensure children get proper nutrition. However, the shift from DSD to DBE has created some challenges in managing learning centers. Also, many centers are not registered, so they cannot receive government support. So in conclusion, this article shows that children development depends on a healthy and safe environment. Using Yuri Bronfenbrenner theory, the study highlight problems like poor facilities and lack of proper nutrition. The article Managing Young Children's Health and Safety During the Early Learning Years explained the importance.
Now, moving on to the comparative analysis between Malaysia and South Africa in terms of early childhood education practices. Firstly, we're going to look at the curriculum standards. So, Malaysia focuses on a basic health education, such as recognizing food groups, practicing hand washing steps, and identifying safe and unsafe environments. However, in comparison to South Africa, they provide a more structured approach with a dedicated health education module that runs for 10 hours per week, and this involves a professional health specialist. Next, for meal and hygiene regulations, Malaysia implements a mandated menu framework. So, for example, children must be provided with a daily fruit, vegetables should make up to 30% of the plate, and the sugar intake is no less than 10% for the extra energy added sugar. However, in South Africa, they use a 30-30 macro unit guideline, which includes a self-assessment and conducted by health specialists. And finally, in terms of staff training and child well-being monitoring, Malaysia requires a qualified early childhood educator and trained kitchen staff with the basic food handling certifications, and this is to ensure that they all have regular checkups to um, know the health violations aren't being violated, for example, and it also maintains a well-being for the children's well-being. They are being reported through a well-being profile for each child provided from the government. And in comparison to South Africa requires a bachelor degree for educators and an annual hygiene training workshop for kitchen staff. And this is just for them to refresh their skills every so often so they know the new for example, the new guidelines. And for their child monitoring system, it's mainly paper-based for log. So overall, while both countries have a very structured system, South Africa morely faces more puts more emphasis on the professional involvement, whereas Malaysia focuses on the standardized practices. Now, moving on to the comparative analysis between moving on, I'll be discussing about the analyzation of implications for ECE practices in Malaysia specifically. So, based on the comparison, there are several important implications for early childhood education practices in Malaysia. Firstly, it's the lack of resources. So, many educators may not have the right education or professional knowledge to access the proper training, which thus affects their ability to implement the government-based guideline that they have required. So this affects the children's health and nutrition practices effectively. Next is the lack of reinforcement and monitoring. Even though the policies do exist, there is a limited follow-up from the government or accountability from the teachers, for example, and this may be due to both parties. However, because of this not consistently being backed up, these practices aren't being consistently practiced in daily class in everyday tasks. So it creates a very wide gap, thus creating a not powerful impact. And thirdly, is the limited collaboration between the government and NGOs. This reduces the opportunities for for the schools to do role modeling and support system that could build up the children's knowledge and improve the children's health and nutrition outcomes. And because of this, the lack of reinforcement, it creates very weak relationship, thus not having a very good curriculum in the end. And lastly, there's a lack of public awareness. Without strong support from families and the wider community, it becomes difficult to reinforce these policies in everyday life. So, for example, because the government is not providing more um, importance on this issue, families also do not know anything about it. Thus, they are not able to create an environment for their children to improve their health. So, these challenges highlight the gap between policy and actual practices, showing that supporting and training and awareness are very much needed um, to generate a relationship that is healthy and positive and consistent. So, in the long term, it will benefit the child's health, safety, and nutrition in the future. Moving on, I'll be discussing about the
Hi, Assalamualaikum. My name is Nura Adana Ashikin, and I will explain our recommendations suggest improvement for Malaysian context. For number one is trained teachers training. This is to provide more professional development for preschool teachers and also it improve knowledge in health, nutrition, and safety education. Number two is improve teaching practice. This use more effective and engaging teaching methods and it make learning interactive and easy to understand. Number three is adapt a module to Malaysia context, which is to adjust content based on local culture and lifestyle. And also it's considered Malaysia's multicultural society, which is in Malay, Chinese, India, and also orang asli. Number four is increase parental involvement. This is more to encourage parents to support children's learning at home, and it's also to promote awareness of health and nutrition among family. And last one is number five to ensure sustainability and effectiveness. It's to make modules practical and easy to implement, and also it's ensure long-term use in preschools. Hi, Assalamualaikum. My name is Nura Adana.
Children development in early childhood education depends on health, safety, and nutrition. These are important for both physical growth and learning. While families play the main role, ECE Center must support children through proper planning and care. In Malaysia, there are strict rules like nutrition label and 5-day rotating menus to make sure children get balanced foods. In South Africa, the approach is more flexible, using general nutrition guidelines and policies like the national norms and standard for partial care to protect children's well-being. However, both countries face challenges. These include limited resources, weak monitoring, and lack of teacher training. In Malaysia, teachers may lack knowledge about nutrition. In South Africa, problems include all facilities and changes in government management of ECE centers. When comparing both countries, Malaysia focuses more on strict rules and monitoring, while South Africa focuses more on higher teacher qualifications but less strict nutrition programs. Both countries also struggle with low parental involvement, which affect children's health habits. To improve, programs should be more culturally relevant and suit to local needs. For example, using local Malaysian food instead of Western examples. There should also be stronger cooperation between government and private sector. Lastly, teacher needs more training, especially in rural areas, so that health and safety practices are not just rules but are properly followed to support children growth in adulthood. Children development in early childhood education depends on